Abnormal uterine bleeding accounts for 1/3 of all visits to a gynecologist's office, and most women come in with concerns about having too much or too little bleeding, having periods that are abnormally short or too long, having irregular cycles, or maybe none at all. You should definitely call your doctor if you have periods that last longer than 8 days, or you have abnormally heavy periods, as evidenced by the fact that you're passing clots, having to wear both pads and tampons because it's so heavy, or you have to change one or the other every hour or two, or if you have to get up in the night and change them. That's not normal, and that means that you're having abnormally heavy periods. Also call the doctor if you've gone a total of 3 months without a period and pregnancy has been ruled out as the cause, if you have bleeding or spotting between periods or after intercourse, if you have such painful periods that it affects your ability to function each month, you feel like everything just has to shut down, life has to stop for you, or if you notice a change in the color, odor, or consistency of vaginal discharge, and if you notice a fever associated with abnormal uterine bleeding patterns. All of these things should be reported to your doctor. They'll ask you more specific questions about your observations and concerns, perform an exam, and then decide if further investigation or treatment is necessary for you. Some of the most common causes that they'll look into are fibroids, polyps, adenomyosis. Of course, pregnancy should also be ruled out. Cancer can be a cause, although it's rare. Sometimes infection contributes to it, and birth control can also cause it. If you've been on certain types of birth control, they'll talk to you about whether or not the symptoms you've been having are normally associated with those types of birth control, or if it's abnormal. And if that's the case, then maybe another type of birth control would be better for you. The doctor will also consider other underlying medical conditions that can contribute to it, things like clotting disorders, hypothyroidism, kidney, renal disease, and endocrine problems. One other thing the doctor will consider is the fact that maybe the bleeding isn't coming from the vagina at all. Sometimes a woman has bleeding from the urinary tract or from the rectum, and they can determine where it's coming from just by performing a simple exam. Now, the treatment for abnormal uterine bleeding depends on the cause, and sometimes it means medication, sometimes it means surgery, and another thing a doctor will consider if you've been having a lot of bleeding or heavy bleeding is anemia. Or basically you've lost so much blood that it leaves you feeling very fatigued, you have lack of energy, you might feel a little bit dizzy. So if you've had any of these symptoms, bring this up with your doctor too, and they can investigate by just doing a simple blood test. If you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.